and he's now joining me live สวัสดีค่ะ Dr. Erik
สวัสดีครับคุณนัท how are you
I'm fine and you have you been working from home nowadays
Well, no, I work at Bangkok Anti-Aging Center, and we are still open. We're doing a lot of treatments for boosting people's immune systems, and I think that's the only weapon we have right now to keep coronavirus away or to make it a mild infection.
Yes, and Kun Thepchai, if you are ready, please join us. Dr. Erik, you are now with me, Natha, and Kun Thepchai Yong. Are now doing this program live, and we'd like to chat with you in terms of your experience. And now you must have seen what's the crisis of COVID-19 happening around the world. Has it beyond your prediction before that it has come to this point?
Yes, unfortunately, it surpassed my prediction from before. See, I've been through this once with Ebola. And for any of my friends who were there working with me, we saw how terrible it can get. Now, thankfully, COVID-19 is not Ebola because Ebola was killing over half the people who would show up in our Ebola treatment centers. COVID-19 is different in that it's kind of selecting out older people and sick people. Now, I know we all see that there's a few cases out there where younger people are dying, but in general, it is very, very dangerous to people who are old, over 65, 70, people in their 80s are especially susceptible, and people with chronic diseases like bad diabetes that's not controlled, lung disease, heavy people. So it's very different in that regard. But the lesson that we learned from Ebola that apparently the world did not learn is that there is only one way to handle an epidemic, and that is to lock down anybody who's infected so the virus can die out and then there's less virus.
Yes.
And it's a little concerning to me that when I go through Thailand and I'm on my way to work, I still see so many people out on the street and people standing together and people holding hands and I just kind of cringe because I've already been through this once. Now, I support the Thai government. There's a lot of smart people. They definitely know Thai people better than I do. But my only comment is that the fastest way to get through this is the best way to get through it. And the fastest way that they can keep people effectively in their own homes and stop the spread and get the curve to start going down is going to be the best thing for Thai people and the best thing for the world.
Dr. Erik, is it the right path of trying to fight COVID-19 by having the country locked down and encourage social distancing? Is it the most efficient way to fight it?
Well, the most efficient way is to tell everybody to stay in your home and don't come out. And whatever you can do to accomplish that is going to lower the disease. Now, people have essential things they need to do. People need to go see their doctors. People need to get food. There's certain public services that have to go on. Now, this is kind of all a numbers game, right? It's statistics. The least amount of people you have out wandering around, the least amount of people you have spreading things. Now, when we were in Africa, people say that we fought Ebola, but I can tell you we did not fight Ebola. We corralled Ebola. We found the people that were positive, and we put them in one place, and we separated the sick people from the well people. And that is the only way that we stopped Ebola. Mm-hmm. So, I think we all have to take this lesson. Now, look, I want to get through this epidemic as fast as possible, just like everybody else does. I want people to be able to go out. I want my business to go forward. I want your business to go forward. I want everybody to go about their way. The fastest way we can do that is by stopping the spread. The fastest way we can stop the spread is by stop seeing people. Stop bringing the infections out in public.
And when we see proportion of death rate of COVID-19, people might have told us that it's much lower than the death from Ebola, from SARS, from MERS. So why do we have to be so afraid of COVID-19?
Well, see, that's the weird thing about this virus. It's not the flu and it's not Ebola. Like I said, Ebola's death rate was 43%, and quite honestly, it was much higher than that from where we were. SARS' death rate was 10%. MERS is 28%, I believe. COVID is below 1% for healthy people like you and I. The truth is that 80 to 90% of people getting the infection probably are going to get a mild infection. They won't need to go in the hospital. They won't need the ICU. They won't need ventilators and things like that. But anybody who has the infection can spread it to an older person. So if there was a way we could isolate, and this is the smartest thing we can do right now, if you can isolate the older people and the at-risk population and make sure that they're taken care of and kept away from the public, then you're going to lower your death rate, even if your percentage of infection goes up.
So in fact, to stay at home is not only helping oneself, but to help others, especially the older people and younger people.
Especially the older people. You know, for younger people, this virus is also interesting in that, when I say interesting, it's terrible, of course, but this virus is not affecting children. The death rate for children has been super, super low. And children only get mild infections. Look, we're all learning this. I mean, if you asked anybody 3 months about COVID, you know, nobody's an expert. And now it seems that everybody on Facebook is an expert, right? We're all learning as we go along with the virus. Now, the one thing we do know that's interesting about viruses, this virus does not mutate very much. Viruses that mutate are a big problem because you can't just fight that virus, you have to fight every single mutation. So far for this virus, there's only been found 2 mutations, right? And the reason that happens is interesting. Because this jumped from animals to people, it's a very inexperienced virus, so it doesn't know how to mutate with people yet. Now, one of the big reasons we need to stop this virus is because viruses get very smart. And if you leave them around for a while, they will build up defenses and they'll build up mutations that will allow them to go into different forms. And this is what we don't want, and this is why we need to lock down now.
Eric, you have been through similar situations before. What is it like, I mean, to be spending time at home, say, for 2 months or 3 months? And what is life like, I mean, being confined to your place like that?
I'll tell you something. When we were locking down, we were working in Ebola treatment units in Africa, and it was about 45 to 50 degrees inside. We wore big PPE, and we couldn't see, and it was terrible. And the lockdowns there wasn't very much to do. We just, you know, stayed in some hotel and passed the time, and that was it. I think if the worst thing you ever have to do is stay home for 30 days, then fantastic, right? All of us have been through more hardship in our lives for 30 days than just this, you know? So we have to all kind of take accountability for what's happening right now. Now, you know, for those of us who understand it, have been through it, it makes sense. But for younger people, they can't see this, right? They probably don't have friends who are infected. They haven't been through it. They go, oh, most of the people are living, so, you know, we're invincible, we'll go out and party. And then they find out the hard way. But the people who really find out the hard way are the older people in their houses. And that's the real tragedy of this.
Eric, the fight against this pandemic, is it something that you can set a deadline on? President Trump said that he wanted to reopen large sections of the country by Easter, hoping that by the time there would be packed churches all over the country. Is that makes sense for him to say that?
Well, like I said, you know, I think we all have to be what I would call rigidly flexible in what we do, because it's changing moment to moment to moment. Now, you know, I think the leader of any country, whether it's Thailand or whether it's America, one of their jobs is to give people hope, right? Because they can't go in, they can't cure everything, but they do have to keep people's spirits up and keep the hope up. And they have to remind people, just like we had in Ebola, that one day this will be over and will be forgotten, and it will be a piece of history that hopefully we forget after a while, except for the lessons we're supposed to learn. So the one thing I can tell you is this. If we could effectively get people to stay in for 30 days, just 30 days of not spreading the infection, the virus, a great deal of this virus would recover, the virus dies and it goes away, and we would see a tremendous reduction in the number of cases, just 30 days. Now, for most epidemics, what we want to see is a period of time where somebody's infectious and then add another week onto it for good measure. You know, but the only thing we can't, we know the numbers, we know the statistics. The only thing we can't control is the behavior of people. And that's why I hope Thai people take their leaders seriously and what they're saying, go home. I think they're being very generous by not locking people down. Personally, I'm a big believer in locking people down to accomplish what's good for the greater cause and the greater amount of people.
So if, according to your timeline, if we really stay at home, keep social distancing, perhaps in May, things can be back to normal.
I wouldn't say normal, but I would say on the way to normal. You know, at least when cases go down, people's spirits go up, and some people go back to work. Now, the one thing I kind of agree with that President Trump was hoping was, let's protect our vulnerable populations, okay? If you're in that group that's above a certain age and you have a lot of risk of dying from COVID, then you will stay at home and you will stay isolated. If you have chronic lung diseases, if you have bad diabetes, you will stay home. You know, so we can get some people back to work, because a dead economy is going to eventually kill a lot more people than COVID. So, like I said, we got to be very flexible. And I'd like to, I kind of want to give a shout out to a good friend of mine, Mr. Tom Cruzapan, who's a very, very influential person in Thailand, and he's been giving this message out to a lot of people too. Keep a small circle, stay inside, listen to people. Don't just listen to your leaders, listen to your friends when they're telling you to do it. Listen to the people who influence you. And, you know, I've been watching the message that Tom has given, and it's really kind of spirited me on to try to push this lesson in this direction onto people as well.
Eric, say something that give us some hope.
Well, like I said before, this too will pass. That's the one thing my mother used to always say to me. This too will pass. Listen, we know what we have to do to stop this. We have to stop the spread. This is not rocket science, right? So until we come up with a cure, or until we come up with a vaccine, we have to do what we can do. And it's actually relatively simple. You don't need to be a doctor to understand this. Don't spread the virus, number one. Number two, keep yourself as strong as possible. We have learned from this virus that if you have a strong immune system, you either don't get sick, or you don't know you got sick, or you have a very mild illness and you're able to stay at home, rest for 5 days, and, you know, get up like the flu. So it's the same lesson I give to everybody. Sleep. Get 7 hours of sleep and your immune system will work better. I'm a big believer in vitamin C, vitamin D, vitamin B, and zinc to restore your immune system, right? Eat healthy food. Stop eating sugar. Viruses, bacteria, all the bad things live on sugar. So this is not a time to be sweet. Mike in Kanom cup. Log in Kanom cup. Don't eat Kanom now. But if you do these things, and especially for older people, then I believe you'll be healthier and you have the best chance possible to fight the virus.
Yes. Dr. Erik, I'm just wondering, with the situation which is getting so worse in Italy and Spain, the number of deaths have overtaken the number in China already. What's wrong?
Yes.
What's really going on in Italy and Spain?
Well, you know, I think if you look at the studies, the age of the population affected in China was in I think the average age was about 45, 47, something like that. Now, in the European countries, especially in Spain and in Italy, it's affecting the older population because this is a group of people. You know, in Europe, the older people are very mobile. They're not staying home. They're out. They're socializing. So I think it's more selected out for those people more than likely.
And for people who stay at home, work at home, should they wash their hands as often as they should? What's the advice?
Well, you know, you should take precautions depending on the risk that you will have. Now, me, because I go to my office a few days a week, I wash my hands 40 times a day. I mask up all the time. You know, wearing a mask is good for two things. Number one, it protects the rest of the world for you, and it keeps you from touching your face. If you don't touch your face, I've noticed that neither of you have touched your face for this entire hour so far, and you should really be commended because it's a very difficult thing not to do. But the cleaner you keep things, listen, you can kill this virus with soap and water, right? You don't need 75% alcohol. You just need clean soap and water, and the membrane of the virus will break and the virus can't replicate. So yes, cleaner is better. Keep your house clean, but keep visitors out of your house. You know, I know the one thing that I'm fearful is that people are going to go in lockdown and they'll go, well, I can't meet you at the pub and I can't meet at the restaurant, so why don't you come over my house? In fact, why don't all of you come over my house? Keep your circle small. Like my friend Tom Cruzapon says, keep your circle small. And that's the best advice I can give.
Anything to reckon in Thai? Do you like to speak Thai to Thai people?
ผมไทยผมหวังว่าโควิด -19 ไปเร็วๆครับ ผมอยู่เมืองไทยกว่า16 ปีแล้วครับผมชอบเมืองไทยผมรักเมืองไทยผมชอบคนไทยมากนะผมไม่เอาคนไทยได้ when they don't have to. Okay, nobody has to die from this if we just follow the rules. I can say that in Thai.
Thank you.
It's good enough.
Thank you very much, Dr. Erik, for joining us.
Oh, my pleasure. Thank you for asking me to join the program. You're doing a great service for Thai people.
Yeah. Nice talking to you.
Okay. Bye-bye.
Keep safe.
Okay, so that's Dr. Erik Fleischman, who is senior former advisor to President Bill Clinton in fighting the virus initiative. So that's the advice that Dr. Erik